Any surgical procedure that involves decompression in close proximity to a nerve, artery, or vein comes with inherent risks. I have thoracic outlet syndrome. It took me 5 years to discover that it was this disease. My doctor will do the surgery as I'm in urgent need. What to do? Guys, Sandra's dilemma regarding the thoracic outlet surgery is completely valid and understandable. Why? Because this is a very high-risk procedure. Any surgical procedure that involves decompression near a nerve, artery, and vein carries inherent risks that should be carefully considered. Surgery requires specialist and general anesthesia for procedure. Preferably, a specialist in peripheral nerves or vascular surgery with experience in the field. Why? During the surgical procedure, several important nerves pass. For example, the phrenic nerve for breathing, the long thoracic nerve that takes care of our scapula, the nerves of the entire arm, and also the subclavian artery and vein that vascularize our upper limb. Therefore, if you are going to undergo surgery for thoracic outlet syndrome, seek a specialist who understands and has already performed this procedure so that you have a greater chance of success. The risks associated with this surgical procedure include the potential risks of anesthesia, the likelihood of infection, the possibility of bleeding, and the potential loss of strength resulting from nerve damage. Therefore, in order to minimize these risks, it is extremely important to undergo the procedure with someone who understands, preferably with neuromonitoring, so that you can decompress these nerves more effectively and have less risk of suffering a nerve injury during this surgical procedure. In addition, a risk that no one talks about that is one of the scariest for me is the risk of the patient not having a satisfactory improvement. Thoracic outlet syndrome results from a postural issue. If by chance we perform a perfect surgery, decompress the nerves, decompress the vessels, and the patient does not take care of his posture throughout life, there is a great chance that these symptoms will return. What happens next? We are left with no option for surgery to solve this problem because everything has already been removed and yet the person still experiences pain. Therefore, if you want to know what the risks and indications are, as well as how to improve from thoracic outlet syndrome, like this video and subscribe to our channel.